This week, we're going to talk about, do you continue to stay fertile after surgery for radical prostatectomy? So what does radical prostatectomy mean? Radical prostatectomy just means that a removal of the whole prostate plus its accessory organ such as the seminal vesicles. What does the prostate do? In fact, prostate produces the liquid for the sperm to swim in, that is a lubrication and also nutrition for the sperms. For when the prostate is removed, there is literally no ejaculation, and therefore men will have dry orgasm, but there is no secretions at all. So what happened to all the sperms? In fact, the sperms continue to stay in the testicles and just avoided being ejaculated because there's no ejaculation. For somebody who continue to want to father a child, then there are two options. Before the operation, you can preserve as much sperm as possible and freeze that for rainy days in the future so that you can use the sperms. Alternatively, in the event that you continue to want to have the operation despite having no preservation of frozen sperm, then we can do something called MESA, which is microscopic epididymal sperm aspiration, or PESA, percutaneous epididymal sperm aspiration. Basically what it means is directly going to the access to the testicle and epididymis, find the sperms and use the sperms for test tube baby or IVF. With such technology, men don't even have to worry about not being able to father a child after treatment of radical prostatectomy. So there's no reason to avoid the operation for the cure of cancer following radical prostatectomy. So for the following week, we want to discuss the problem about hormonal suppressions and erectile dysfunction for men who use hormone for the treatment of prostate cancer. If you're on hormonal treatment and you're a bit curious about how this is affecting you, and they need to stay tuned for next week's Putting Dr. G on the Spot.